Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video section, I will be talking to you about, very briefly, what are the effects of the illicit drugs that one can end up using or abusing, as a matter of fact, which can affect the heart. Well, some of the drugs that I've listed here are cocaine, LSD, marijuana, heroin, amphetamines, and whether they are intravenous or inhalant route. The effects can range from hyperactivity to paranoia. For instance, with heroin and cocaine, one can get tremors, transient euphoria, but then later on violent behavior. Very fast heartbeats can occur. Irregular heartbeats can occur, as I've shown here on the strips. Arrhythmias can develop. Sometimes they're life-threatening. Blood pressure rises. It's called hypertension. Chest pains occur because these arteries, the coronaries, can get obstructed or they can go into spasms. And heart attacks can follow. A patient can develop a seizure, a convulsion, also can develop a stroke because the same phenomenon is going on in the brain vessels. Later on, go into a coma and die. And death is the ultimate. But the fact is that these drugs, specifically cocaine, heroin, whether they are being used inhalantly or intravenously, they can cause these problems. Specifically speaking to the intravenous abuse, it's the right-sided valves, heart valves, that get infected because of the unclean habits and perhaps the shared needles that the IV drug abusers get to use. And that leads one to develop an endocarditis, we call it, where the infection is in the blood, obviously, but also it's harbingered into these right-sided valves. Remember, heart has 4 valves, right? So the right-sided valves get affected first, and then later on even the left-sided valves can get infected. Of course, in between the circulation there is lungs, and then the lungs get infected and abscesses or even pneumonias can develop. You can think of abscesses literally from brain to wherever else that you can think of. Even distal abscesses in the lower extremities have been reported. Lung abscesses, brain abscesses, splenic abscesses, renal infections, etc., etc. So no organ is really immune to the infection that happens from the intravenous abuse. And of course, the inhalant variety can cause pneumonias and bronchitis and severe lung and other infections and fluid collections, etc., etc. But as far as the heart is concerned, again, the rhythm disturbances are very, very predominant because of the stimulants. The amphetamines specifically can cause tachycardia or fast heartbeat like this, irregular arrhythmias, and death can ensue. And of course, using unclean needles, which is unfortunately the norm in IV drug abusers because they can't procure the aseptic needles or clean needles, so they end up getting hepatitis B and C from shared individuals and even HIV. So it's a losing battle with use of illicit drugs. There's no way that a person is going to benefit at all unless until he or she is immediately brought to counseling and is rendered drug-free. Even the companies, before they hire an individual, they automatically do a screen, a urine screen, or sometimes even a blood screen, specifically in the military, for instance. But firms and companies will not hire unless until the urine samples are clean of any toxicology, of any kind, of any drug. So lots of information out there, but I thought I'd just give you some basics about how the illicit drugs can affect the heart, here as seen on these rhythms, and of course here in this schematic where the coronaries and the heart and the valves get affected. Anyway, more so later, we'll discuss more so in the subsequent sections. So stay drug-free, say no. All right, guys, see you again.